somebody survived, but what are you doing with the addict? What are you doing with the person? What solutions have you given them? Are they being sent to a treatment facility? And the answer is invariably no.
Yes, overdose deaths were down in 2024, the first year in quite some time that's happened. But that's a sign of several things.
When somebody's doing statistics, they make it so convoluted that it's almost like they just don't give you the real facts. They throw other equations.
The overdose death rate is down, but that doesn't mean addiction is down and recovery is up.
This is the Don't Hide the Scars podcast, presented by Pain, Parents and Addicts in Need.
Mr. Andersen, how are we, good sir?
I'm good, Mr. LaChance. What's new on the home front?
Well, hey, it's a busy launch for us here in 2025. I'm still adjusting to a 25.
Yep.
And this had come up in a conversation and with someone else that had said, well, the overdose deaths rates are down, so that must be a really good sign for what you all do. And it's I really wanted to get in with you how there's a misleading. That's misleading. Yes, we're glad there are less deaths, but there is some very harsh truths that come with the fact that, yes, overdose deaths were down in 2024, the first year in quite some time that's happened. But that's a sign of several things. And I think the first and easiest one to start with that maybe a little bleak, because a lot of the addicts have died.
Yeah. 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 I mean, as much as I hate to admit it, that's probably the case, but again, I think this whole thing is very misleading. Again, when somebody's doing statistics, they make it so convoluted that it's almost like they just don't give you the real facts. They throw other equations in there and other reasons, and it's a lot of it just doesn't make any sense to us normal people when they're coming up with these charts and these graphs. And again, it just doesn't make any sense. But if let's say it is true, by how much did it drop? Yeah, that's the first thing we need to find out. Do you know by any chance by how much it dropped?
Their estimations is around a percentage of about 17%.
That seems awfully high to me.
Yeah,
that seems awfully high. Because again, you always, you just can't assume this is the homeless, the street people that are dying here. And when you get minors that die of this, a lot of times autopsies are not given. The family may not want the autopsy done for whatever reasons. Sometimes sorry about that. Sometimes they may give another reason why. There might have been drugs in the system, but it might be because of a heart issue that accompanied the addiction. I mean, I've heard it all over the years, and again, I'm not, I'm not saying they haven't fallen. That's what we all hope for. That's what we all pray for. That these numbers are coming down. But I know we've talked a little bit about this in the past, and of course, the help of Narcan, the life-saving opioid reversal agent, obviously has made a huge impact in that. But again, as we take it a step further here at our organization, it's okay, somebody survived, but what are you doing with the addict? What are you doing with the person? What solutions have you given them? Are they being sent to a treatment facility? And the answer is invariably no. Right. Every single time, because again, hospitals really don't want to work with those in doing what we do in order to get somebody the actual help that they need. So again, there are lots of different variables that I think come into play here.
Agreed. And I think that's the main thing that people should understand is, yes, there's a multitude of factors that, and probably so the overdose death rate is down, but that doesn't mean addiction is down and recovery is up. Matter of fact, we're seeing it's quite the opposite.
Correct.
I mean, there's some glimmers of hope in the early part of 2025 that we're maybe seeing a shift, but it's not going to happen overnight, and it's not.
No, and I don't want to give false hope to anybody either, but I also want to be, the voice of gloom and doom all the time either.
Right.
But as we progress into 2025 and into the years that to follow, insurance companies have taken a major stance in not providing the right coverage for those with substance use disorder. I mean, they take a major stance on it. They make it so difficult for not only the addict or the client, whatever you want to call those folks, to get the help that they need. And of course, their response to treatment facilities is, in my opinion, beyond criminal, and how they actually, how they pay the treatment facility. It takes forever to get paid on a client. It takes a minimum of 4 months before, once somebody walks into the treatment center, it's a minimum of 4 months before you even see a nickel of that money. And then they take the entire balance of what they owe you and they piecemeal it out to you. So you're never getting the correct amount. And again, as we went through 2024, that was a bad year for treatment, for all treatment facilities. I think there were more than 3,000 to 4,000 treatment centers that shut down in 2024 because they just can't keep up with with the cost of doing business, especially when they're not getting paid. So, on one hand, if those death rates are down, hallelujah, right? But as we've discussed with so many people on this podcast, what about recovery?
Mm-hmm.
And because we all know we are losing the war on recovery. We have so much of the far left, and I'm talking about harm reduction people. I'm talking about all those organizations that, by the way, haven't been heard from too much in 2024. Okay. Whether their funding ran out and they decided to give it up, whatever the case may be. But because of those reasons, because of politics, because of the climate in which we're living in these days, treatment's an afterthought.
Mm-hmm.
In my opinion.
Mm-hmm.
Like Tom Wolfe was saying, it's the folks on the left that are saying, oh, it's your body, you can do what you want with it. The consumption sites that everybody wants to put in play. And it's your body, do what you want, and we're going to support you in that.
Yeah.
But I always go back to something you said a while back. When somebody reaches that point of addiction where now they're using criminal behavior to do things. Now they're at a health point in their life where they can't function. Obviously they're unemployable. All of those things. That's when we as a society need to come in and say, okay, you know what? You're coming with me.
Yeah.
And at least give these individuals a chance at getting their life back. But we're not doing that.
New Perceptions North, the premier drug and alcohol treatment and recovery center in Central California. A full continuum of medically supervised top quality care with programs for detox and patient residential treatment with dual diagnosis, intensive outpatient treatment, sober living support groups, and more. New Perceptions North provides adult men and women with the highest caliber of professional health care, treating each client with compassion and respect. trust in a safe, comfortable environment to begin the process of recovery to proudly create and sustain a life without addiction. Call 559-978-1507 or visit newperceptionsnorth.com.
Yeah, I just think it lacks ultimate humanity, and we know it. And I don't, I mean, you know me, I'm very much a supporter and proponent for autonomy, but that's being an individual that's responsible to society, of course. And there is a point where I think we lose our humanity if we just continue to go, man, that's fine. Go ahead and die. I can't. It's one of the things that at night, hopefully I'm not thinking about, because it will keep me up and it bothers me.
Sure.
It greatly bothers me, and it bothers me that more and more people cannot get the help that is needed and required, and that there isn't a quicker adjustment to what is going on when it becomes the face of addiction. It's just some of it's just half measures, and those that, as you well know, can provide the full measures, you're not equipping them. And that is the proper insurance that can cover and get these people in, and costs or funding and whatever that avenue might be. Hey, I think that would be an amazing grant. But it's disheartening. It's disheartening. So it's good again to see that the numbers from what the CDC has collected, that the data shows that there's a downward trend in overdoses, but we are not seeing that downward trend in addiction, and I'm personally not seeing the uptick in recovery.
No, and look, we still have the demand for drugs. We are a drug-driven society. And what I mean by that is, let's just look at the marijuana issue. Just think about how many people in the United States think it's perfectly okay. Light up wherever you want.
Oh, yeah.
Without looking at the long-term health risks that are involved with that, and looking at the fact that a 17-year-old's brain is unable to handle the potency of the marijuana today. And we all know where that leads. People can argue with me and with you and I to the cows come home, and I'm still going to have the argument that these young brains, these young minds, okay, that they're incapable of handling that potent of a drug. And again, we're still that society of if it hurts, take a pill. If it's this, take a pill. If you're depressed, take a pill. If you're this, take a pill. And we've been in that mode for centuries.
Mm-hmm.
And really, I mean, again, I don't think I'm speaking out of turn. None of that has changed. None of that has changed. Addiction is still addiction, whatever drug you're using. We all know fentanyl has changed the game drastically in this. It is more difficult to get off of fentanyl than almost any other drug out there, But why as a society are we so afraid to make these changes? And you and I know the reason. What you always say, follow the
money.
That's it.
Yeah.
Follow the money. When greed becomes, look, there's nothing wrong with businesses making money. There's nothing, and that includes insurance companies. That includes the medical community. That includes treatment people. That includes everybody that works. Okay. It is a good thing. It is a just thing. It is a moral thing. Okay. But when the greed gets to the point where the money is so great, that greed, I don't care who you are, it almost seems just to take somebody over. Okay. And to hell with the rest of us, and the hell with the rest of the problem that they're trying to address. And as long as we have that, first of all, I don't think that's ever going to change. We've got to get somebody with a big set of you know what, okay, to come in and at least start addressing these issues and hopefully making that change somewhere. Because, like I said, as long as we have the demand for all of these drugs, the supply is going to get here. Our new border czar, Tom Homan, he can shut down that border all he wants to. And by the way, I'm in agreement with him. Okay. They're going to find a way to get it in.
Mm-hmm.
And here's another thing to look at with that. We all know China sells the precursors to Mexico. Mexico makes the fentanyl. They bring it over the border. So now you take greed over here again. You don't think China is going to find somebody in the United States that's willing to accept the precursors?
Yeah.
Because we're making it in a lab.
Yeah.
We're making it in somebody's house. We're not growing it. We're not cultivating it. We're not watering it.
Yeah.
I mean, of course. So,
well, and we had watched that documentary. I'm drawing a blank on it right now on Vice, where they did that on the dark web, and they had done the purchasing of it, of the chemicals. So they always find a way. I mean, we've talked about it before, where there's a cartel that had the submarine. Yeah.
Right.
What was it, the 1960s, 70s?
1970s, and down in Florida, these cartel guys actually bought a submarine.
Yeah.
Okay, and this thing was probably from 1940. And I could just see three members of their cartel in their pedaling the thing like Joe Boats at Roding Park. Okay, trying to go deep enough. I mean, yeah, they're always going to find a way.
And you bring up such a valid point. It's for us to make any dent in this. It's not a one-headed dragon. Yes, the locking down the borders important. Yes, the criminal element that is here illegal. Yes, finding and having resources that are preventative. Before you even go down that road of substance use into the abuse area. It's how do we do all these things, societally, to bring any sort of shift. And it's hard to get it behind it, because that's always the thing. Well, where are you going to get the money? And when you go, where are you going to get the money? It tends to always be from someone that goes, yeah, I'll get you the money, but how are you going to make me some money off of it? And then that's just how business works. So I understand that element. It's just hard to shift an entire system that's worked a certain way. And I use the word work lightheartedly. It's had a functionality to it for so long. How do we get that to completely change? And,
yeah, I mean, how do like when we were talking with Tom Wolf, right? And it's like, and Tom's telling us about, about the different organizations that are receiving X amount of dollars, over the previous year or the last couple of years. And literally hundreds of millions of dollars going towards, the dancesafe.org people, the long-term harm reduction people that want to make all drugs legal, make all illegal drugs legal, and don't care if somebody's using. And of course, now the rest of society can pay for all their health issues and their drugs. And, and like he was mentioning, what kind of kit was it called again? A hygiene kit.
Yeah.
Right. To where, you imagine a hygiene kit that would have a toothbrush and toothpaste and deodorant and, whatever the case may be. But in that hygiene kit, they're adding syringes and tinfoil and cotton balls, everything you need to shoot up, spoons,
straws,
right? All of it. And one of our governmental agencies is giving, $32 million. That's if that's the number is correct there, what Tom was saying, $32 million to an organization that passes those out every day.
Mm-hmm.
on our streets. And that $32 million, instead of giving somebody a fucking syringe to shove in their neck, can you imagine what $32 million would do? I mean, $32 million in today's world is not a lot of money. But you get 42 organizations that are getting $32 million each. Now that's serious money. And that serious money could be used to actually give people the help that they truly need.
Yeah, absolutely.
It's criminal again, in my opinion.
Yeah, well, and you figure if we just to throw out a rough, cash value amount, for every, well, you figure about every 90 to $100,000, you got a 3 to 4 month stay for someone in a facility, and that's covering costs. People go, well, that much? Yeah, that much, because you got doctors, you got food, you got insurance, you got all the staffing 24/7. There's a lot of moving pieces that it takes to care for one individual through their recovery process and the detox process, of course, the start of it all. So, but it can make some really big dents. That is for sure.
Yeah. You really can. I mean, like anything else, it's an investment. It's an investment into America's future. Because right now, I mean, I don't even know what the number is of how many addicts we have in this country. I would imagine it's well over a few million, to be honest with you. And then you take the people that are like halfway there, who aren't considered addicts yet, but are certainly on their way. I mean, when you just look at the pharmaceutical numbers of the amount of prescriptions that were written in the previous year, it's astronomical. And I'm not talking about blood pressure medicine. I'm talking about straight up narcotics, pain pills, Valium, Xanax, whatever it is. The numbers are astronomical.
Yeah.
And that has to tell you something right there as well. So again, we just, I don't know, that's why I'll be honest with you. That's why it's even hard for me to believe that this thing has gone down. It really is hard for me to believe that overdose rates have gone down. Now, I will say this in our area, I have not, in 2024, there were a few deaths that we knew about. But nothing like 23, 22, 21, 20, 19, and 18. But you have to ask yourself, where are those people going to wind up eventually that didn't OD, because they're still using.
Yeah.
They're still using. And when you look at the treatment numbers for 2024, all of us in the treatment industry, everybody's census was down. Some as much as 60% down. From 23 to 24 was a shit year. Okay. And so where are those people?
Right.
Where are the people? That has something to do with the insurances. Their deductibles are way too expensive. They don't have the right coverage. The insurance company said, no, you know what? We don't think you need treatment at this point. I mean, seriously.
Yeah.
So again, I just think at some point in the next few years, that there's going to be some numbers that are going to blow us right out of the doors.
Yeah, I'm afraid to as well. But hey, we always continue to shine that light of hope, because there is recovery. We've done it, and we know other people can do it. And, it's a badge of honor. And, just again, if someone really is struggling, or you have a loved one and you're listening to this and they're struggling, or you yourself are having a tough time with their addiction, please don't hesitate to reach out to us. Of course, don't forget the support group meeting on Wednesday nights that Flindt conducts. You've done amazing work for over a decade with that and that family support group, and really helping family members understanding what they're dealing with when it comes to an addict that is still in their addiction or early in their recovery, and some of those things that can, will, and do occur. So, we're always here.
And the other thing I want to add to that is look, for those that are listening, you just don't need your child or your loved one to be in full-blown addiction before coming to these family support meetings. We have several parents here right now that that are in the extreme early stages of some very minor, and I mean minor, drug use. Okay. And it's not even as big as an experimentation stage, but they're noticing little behavior changes in their kid. They're noticing that their style of dress is changing. They're noticing that a couple of their really good friends are now not hanging around as much anymore. And now there's some new friends popping in. And we've got a few parents right now that have come in here like bulls in a china closet. All right, going, okay, what do we do to get ahead of this thing? Because like anything else, that's one of our goals here at Pain is to have these parents get in front of this thing before they have to walk in here and now they're living in hell and they don't know what to do and their kid's on their last leg. So our parent meetings are also preventative meetings as well.
Yep.
And we address that quite often.
Well, and I know it's not the exact wording, but the best way to win a war is that it never starts.
Correct. That's exactly it. Read Sun Tzu.
Yeah.
There it is. But yeah. Again, I'm just not quite sure on these overdose rates coming down. I think we, again, as a society, have done a damn good job of the Narcan program and getting people aware of that. I think more and more people are becoming comfortable with having Narcan. We've educated extremely well on its use, the fact that it has no other dangers to it, that there's no other properties to it. You can't get hooked on it. It's not a narcotic. A kid can swallow an entire bottle and nothing's going to happen to him, so but we just can't keep going down the same path, of, okay, well, here's some Narcan. Let's hope for the best, because it's not something that helps you with your addiction. It helps save your life, period.
Absolutely. And if you are interested in, for you as an individual, for your family, for your organization, and being trained on and obtaining some Narcan through us, again, please don't hesitate to reach out to us. You could go to painnonprofit.org, our website, and you get the phone number there, email us, and please, that's why we're here. Mr. Andersen.
Mr. LaChance, thanks as always, buddy. Okay, it's a start to a new year. I'm really looking forward to this year. You already know we're already starting to do some things that we're excited about, and we're gonna hit it hard, and we're gonna make sure that this message keeps getting out, because there's still some lives out there that need to be saved. That's for sure.
Yes, sir. And we thank you all for listening to the podcast on Apple Podcast or Spotify, or you can go to our YouTube page and watch along. That's youtube.com/@painnonprofit. Subscribe today, and please share the podcast with someone else will get value out of it.
If you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at painnonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, Please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.